Hello, welcome to Arizona Alpha's COVID update. We took about a 6-month hiatus from doing COVID updates, but as our numbers continue to increase with the Delta variant, I feel the need that we probably need to start chatting about this more often. As most of you are aware of, I'm sure our numbers are ranging right around 1,500 a day for the past 7 to 10 days. The hospitals are filling up, but they're not full to capacity like they were. And currently 98% of the cases are unvaccinated people or people that only received one part of the vaccination and not two. So far, if you're vaccinated, it looks like you're okay, but we encourage everybody who's not vaccinated to get vaccinated. I'm sure most of you guys have seen in the paper that Banner is requiring, as of November 1st, all of their employees or healthcare workers to be vaccinated. Honor Health has done the same. And the United States Veteran Administration has come out and said the same for all their healthcare workers must be vaccinated as well. So I think we're seeing a trend across the country that the charges to take care of the resident or in the hospital, the patient. So we need to do what we can to take care of our residents. So we are strongly encouraging you to strongly encourage your staff to become vaccinated if they are not. We were getting some phone calls about the governor's task force on reopening. The governor's task force is not reformed. I'm not sure where they will. We're still following these guidance. If you've got this document, please make sure it says April 2nd, 2021. Most of the counties are close to substantial, if not insubstantial spread. And what that means as far as visitation and such, if you're at substantial indoor visitation at all times, for our residents who are 70% or more vaccinated. So you can still have indoor visitation if your staff is 70% or more vaccinated. Also, outdoor visitation, no testing required. You can maintain outdoor visitation, and visits for compassionate care, medical, dental, and behavioral health care and clergy are still permitted, no testing required. Also, no testing required for outdoor visits. Symptom screening and face coverings, face masks, not the goiters, but the mask still required. Physical distancing required. Communal state spaces may remain open, and off-site medical appointments. So that's the key, off-site medical appointments. Walmart, unless you got a doctor at Walmart, that stuff kind of pretty has to be tapered down while we work through this latest variant. There has been no new updates except for that. We are watching closely. We are on weekly calls with the governor's office as well as the various counties to see how they are doing. If you have any questions or concerns, please call our office. That's what we're here for, to answer your questions. The Department of Health Services, we've been in contact with them as well. And right now, everybody is still following the CDC guidelines. So whenever you see the CDC make a change, and I'm sure if you've been following, rumor has it that they might start mandating mask wearing, but they have not as of yet. We're strongly recommending mask wearing amongst everybody to try to curtail this. But in the interim, just follow the CDC guidelines. If you have any other questions, you guys let me know. You can reach out to myself or Mariah. Also, our fall conference, this plan is still to be in person on October 20th. There'll be a reception October 19th, and the conference is October 20th. At the Hilton at the Peak, which is at 16th Street and Glendale, right off the 51. So we are still planning on moving forward with that, as well as our Gentum's annual conferences in September down at the Phoenix Conference Center, Convention Center, and they are still planning to move forward with that. Let me know if you have any questions. Oh, update on the NCAA board. We did run a bill. The NCAA board was extended through March 2022. There'll be a study committee formed to study the different issues with the board. You know, the main challenge with the board, we had long discussions with Senator Pace as well as the governor's office, is when they put assisted living over to the NCAA board, there were 18 assisted living at that time. There are now, you know, I forget the count of managers. I want to say, I won't quote a number because I'm not sure how many managers there are, but they dumped this huge influx of people onto this board. They did not increase staffing at all. They still have an investigator, another person, and the ED and the front desk. So they still have a staff of 4. They're processing, I am going to say a number, they're processing, I believe, 2,500 assisted living managers license right now. And that processing begins July 1st. So you can imagine how much work has been put over to them. They are processing manager's license. They are still moving forward. I believe the next meeting, which is always on the 3rd Monday of every month, I believe is taking place in August. They held the July meeting, but I'll let you know. Also, fingerprinting. Fingerprinting, as you know, has been changed. If you have any questions, you can go to our website. All this information is posted to our website to see any updates to the fingerprint requirements. And we're working on a bill to take the fingerprint requirement as to where we've been following now to the statute. If you're interested in participating in that, you'd like to be on the public policy committee, please reach out to me. If you're interested in memory care, we have a great memory care committee. Educational events that plans all of our educations. We will begin doing webinars shortly, monthly webinars to help increase our training. If you have any topics you're interested, let us know, as well as if you know any speakers. Otherwise, have a great day. Again, if you have any questions, let me know. Otherwise, I'll talk to you guys later. Have a great day.